Dr. Ravi Rannan-Eliya, thank you very much for being on Insight.
Yeah.
So I've invited you on primarily because of the polling that's carried out by the Institute of Policy
Yeah.
Health, where you are the executive director. So before we get into the political polling, it's an election year. There's a lot of questions that people have. And just for our audience's sake, we've taken questions from Twitter. So we'll be asking direct questions as they've been noted on Twitter and posting them to Dr. Ravi. But first of all, I want to start by asking you to clarify the role of the Institute of Health Policy and presidential polling or of political polling. What is the link between the two? Because a lot of people seem to be confused as to why an institute that's the name says it's for health policy. Why is it involved in polling?
Sure. I mean, that's a question that is frequently asked on Twitter, and that's where I encounter it. So I think several things are put in background. I mean, first of all, I would say that I'm a public health specialist, and I work on health policy primarily. And for health policy, public opinion in a democracy is fundamentally important. And in fact, I have written about the evolution of Sri Lanka's health system. Sri Lanka has, in fact, one of the world's best performing health systems in terms of the outcomes it achieves and the satisfaction it gives the population with the money that it gets, which is not very much. So it's one of the world's best performers, right? And that was not the case if you go back 100 years. The reason that changed, why we became different to the rest of South Asia, the British Raj, was because the Donald Commission back in the late 1920s made a very critical observation. They said, look, we're going to give self-government to the Ceylonese, I guess, or Sri Lankans, but the rulers are not going to pay attention to issues of social conditions, and social conditions, including infant health, are terrible. Housing conditions are terrible. And so they said we have to ensure the rulers are accountable and under British rule, because it was self-government, and they should be universal. They should be, first of all, suffrage for all men, but most importantly for women, because women also are particularly concerned about these issues. That was their idea. It was a hypothesis. And they were absolutely right. So they socially engineered Sri Lanka's political economy starting in 1931. And so health policy, the health system we have, is different to South Asia. And it reflects that democratic heritage. So that's what I know as a Sri Lankan health policy person. But I think in any democracy, health is ultimately a political issue. And so understanding public opinion is critical to that. So I think that's the broad explanation. And then I would add, I mean, the other reason we do polling is we can. And there are two reasons for the we can. We have two assets in a sense, which enable us to get into this space. The first is I actually have training. So I am the executive director. I direct this particular part of the work, which is the polling part. I'm actually trained formally in public opinion polling at Harvard University. And interestingly, I put that on Twitter last night. The Harvard University is a huge university with many schools. It's a research university. But Harvard, for at least 30 years, they've had a university-wide public opinion program, which does research on opinion polling, but teaches also people to do opinion polling, including presidential polls. And I'm a student. I went through that program as well, or to the courses that they organize. And that program is based in the Harvard School of Public Health. So, in fact, if you read the U.S. mainstream press, Washington Post, New York Times, you will typically see about once every 2 months a headline poll, and you go look in the footnotes, Harvard is involved. It's people from the School of Public Health. So I think, that's what they do in America. That's where I learned my stuff. So I have that technical capacity. The other asset we have, which enables us to do this beyond simply wanting to have this information, is that we have this. Almost coincidentally, back in 2019, literally before COVID, we recruited a large national sample of people for a very large scientific study, and that's approved by the Ministry of Health.
How large was the sample?
There were 7,000 households. And it was a very robust design. It was designed for epidemiological research purposes. And so it's incredibly robust. It's probably more robust in terms of its sampling than even standard health surveys in Sri Lanka. And I won't go into the details of that. And we use kind of the latest thinking about how you should sample from Europe and the US. But the other thing is that in that survey, it wasn't just a cross-sectional survey, literally finished 3 days before the presidential election in 2019. So interesting, it was over 12 months. But the other thing is that people who were recruited in the study gave permission to be resurveyed on an indefinite basis into the future. So our ambition was to track the conditions of this nationally representative sample of households, their health, their aging, it was a big focus of this, their experience with social services, their healthcare use, and their opinions over decades. And that was the kind of ambition we had. So this was a legitimate scientific project, and we happened to have that. And so when COVID came along, we didn't have money. I mean, there's very little research money in Sri Lanka, unfortunately, but we eventually got money from outside to do what many other countries did during COVID right from the beginning, which was to use these existing samples to track the impact of COVID, how it's affecting households. So we started doing that in late 21. We started doing that as a phone interview survey. And we added from the beginning, at the very end, we had some voting intention questions, which is, well, see how they would work out. And so we just run with it. So I should explain that this political polling we're doing is about literally, it's about 8% of, it's about typically 3 minutes worth of questions in an interview, which is typically 30 minutes. So it's about less than 1/10 of that survey are the politically related questions, which include not just voting.
But they're getting a lot of attention. So, and I think we'll go into the latest available polling data that you've released with the Institute for Policy Health. So this is for January 2024. Is that the latest one that we have?
I think we've published estimates for January 24. I should just explain why. I mean, yes, it does get a lot of publicity, and that's probably why I'm sitting here today with you.
Yes.
I mean, the reality is that most of the data we collect is not related to political voting intention, but it's related. I mean, we cover lots of things: food security, mental health, healthcare use, employment change, the income status of households, and financial stress. All sorts of things. COVID vaccination, we continue to track that. We track even things like COVID symptoms, which could be COVID. And in fact, we've picked up 2 COVID waves since the Ministry of Health stopped testing. So I mean, they stopped testing more than almost 2 years ago now. So there's basically no data, but we can clearly see there have been 2 subsequent waves, just as in other countries, and that we can pick up from our phone survey. So this is all legitimate research. The problem with most of the research stuff that we do, it will typically take 2 years to be published. To a peer-reviewed publication process, writing a manuscript, and it's only just stuff that's just beginning to come out. We just published a paper on COVID, a kind of retrospective review of the COVID response a month ago in the BMJ, which used some of this data. But it takes an incredibly long time. And I think my view is that, look, we have this data on voting intention. It's an election year. It's a democracy still, right? We should be proud of that. And it would be very selfish of us as researchers to sit on this data for 2 years till after the election. It is, I think, our moral obligation, our ethical obligation, and obligation to citizens, since we have this information, to put it out. So we don't go through the normal scientific channels. We do the analysis and we put it out on social media.
Right. So I'll be putting up the most recent polling data on screen right now. And as per that, Anurukumar Dissanayake of the JVP leads with 50% of all adults. Yeah. So that's a -1 from the previous time, according to...
-1 from our latest estimate of intentions in December. But in fact, as I think one of the editors, one of the media organizations asked me about, that we had actually changed our December estimate slightly from what was published the previous month. So we do improve our estimates as we go.
Okay, so Anurukumar Dissanayake at 50%, Sajid Premdas at 36%, the President Ranil Wickremesinghe at 7%, and an SLPP candidate also at 7%. There's one question I want to go into before I take on the Twitter questions. What about undecideds and no preferences? Is there something in the polling that asks that question? Because it's not represented in the...
So there are 2 aspects to this. The presidential voting intent question is handled differently to the general election voting intent question. So for the general election voting question, we ask which party you want to vote for. There's a whole list of parties in the list, and there's an other, and we ask people now if they say other, who the other might be. And typically, if it's very common, we'll add it to the list, right? So I would imagine Frontline Socialist Party got into the list, and then actually it turns out not many people will vote for Frontline Socialist Party. Maybe they're not even going to stand, who knows? So we added it, but we monitor that. The presidential question is a bit different, and it has to be, because not every party is going to stand. And in the nature of the election process, you have to win 50% of the preference votes. So you have to keep it relatively simple. So for the moment, we've been giving, well, actually, originally we gave people only 3 choices, which was previous president and then Sajid Premadasa and Anura Dissanayake. And then, those are the only choice. And then when Ranil Wickremesinghe became president, we added that in. And now we have a generic SLPP candidate because I don't think former President Rajapaksa is going to stand again. So we give people these 4 choices, and they can say none of them, and people can respond, we're not going to vote, or we're not going to vote, well, we might not vote for any of them, but we try and get them to make a choice. And some for people who say they can't decide, we do ask them, well, if you can't decide, who would your preference be? So there is a second follow-up question. Because in a presidential election, you don't have all your choices. It's constrained. So that's what we do. I mean, there are obviously other people who are making in the media who kind of signaling they're going to stand in the presidential election, but we decided to keep it simple. So the current president and the 3 major parties in the country. So that's the first part. On the issue of people who don't, we have a significant percentage of people in the voting questions who don't answer. So they refuse to answer, or they give evasive responses like we don't know, but we don't think it's really a don't know. That it's just a nice way of saying they don't want to answer. And this only affects the voting intention question. So in the rest of the survey, 90% of the survey, the response rate for most questions is above 95%. For the voting intent, for understandable reasons, it's typically been around 25%. It was even higher 2 years ago when we first started. And so what we do with those people who say we treat them as missing data, they probably have a view, but they're not going to tell us. We model, for the stuff that we publish on voting intent, we actually model what their likely vote preference would be. So that's how we deal with it. We don't ignore them. We actually look at that data, and then we use the statistical methods to essentially say, if somebody tells, and I'll give you what I mean by that, you might have, let's say we have a Tamil voter from Kilinochchi, right? And he might have told us that, and let's say it's a he, it's a male, may have told us that they voted for, let's say ITAC in the general election last time, but they voted for Sajid Premadasa in the presidential. Okay? And this person hasn't answered. And we think, they don't want to answer. So what we do is we estimate the probabilities that he would now vote for, say, Sajid Premadasa or Anura Dissanayake or Ranil Wickremesinghe, and we get an output which says, look, he's probably 70% likely to vote for Sajid Premadasa, he's 20% likely to vote for Anura Dissanayake, and we use those probabilities as we do the final analysis.
Okay, great.
Yeah.
So then I'll just go straight to the questions that are on Twitter. So one of them asks, I don't know if you can tell us what questions are specifically asked, political questions. You gave a few. You want to list out?
We do report in our social media communications the actual question. It's on the image, but if I remember correctly, for the voting questions, we asked if there was a general election today, who would you vote for? And then to initially let them respond, but then if they're not responding, we'll give them a list. The list has about 16, 17 parties. There are a lot of parties here in Sri Lanka. And then similar question for the presidential election. But the other thing I should say, before we ask, those are the last 2 questions in the survey, pretty much. Before we ask those questions, we also ask them, and this has a higher response rate typically, if they voted in the last 2 elections, and then if they did, who did they vote for? That's the 2019 and 2020 presidential general elections. So we typically get more information from that, and then we ask them, who would you vote for today? And then some people will typically drop out, they won't answer it. So that's the political module. There is a preceding module that we asked, which is also sort of politically related, where we asked for people's opinions, favorabilities or favorability ratings, and also job approval ratings. So job approval ratings for key, I would say, constitutional figures. So the president, the prime minister, the leader of the opposition, and the health minister, because the health ministry, we track all the health ministers. And we also track the favorability of previous health ministers, so the ones who left office. And then we have favorability questions. The favorability questions, now people don't get all of them. We randomize them, but typically people are asked about some current politicians. So again, the key politicians, Sajid Premadasa, Anwar Dissanayake, Ranil, are always asked, and then they get a random subset of other, typically members of parliament, so from various parties. And then we also have a historical section. We actually have been tracking the favorability ratings of historical figures, including D.S. Senanayake, W. Senanayake, Mr. Prabhakaran, even Mr. Wijetilleke, I guess the founder of the JVP. So those we've been asking for a long time, and essentially all the previous presidents, major presidents or prime ministers, we have historical people, they're dead. We have been tracking ever since the past 2 years. So that's just get a sense of what people think about historical figures. So, and then we get into this voting questions. And now all of this is after, 20 minutes, 25 minutes of questions on their health status, household situation, their employment, their income, their COVID status, so right at the end.
I don't know if you can answer this one. Since IHP started, what's been the largest 1% change in a 6-month period? Would you be able to say off the top of your head, roughly?
Well, maybe not 6 months. I'll tell you what the big changes that we observe. Okay. We started this in, I think, August 21. And at the time, President Rajapaksa, at least amongst people who responded to those questions, very favorable, people would vote for him. Large bunch of people who would.
What date was that?
August 21. So we started at the end of August 21. And so 321, basically, anyone who answered the presidential question said they would vote for him. But we did have a large bunch of people who wouldn't answer the question, but they also told us they voted for Sajid Premadasa in the previous election. So, you could deduce these are sort of there's some, depending on who you supported, affected how you would answer that question. Yeah. And so we observed that. And then his support really began to weaken late 21. So late 21 in the rest of our survey, and I think I told the previous time I came here, we began to pick up problems in the economy. We came out of lockdown, but then people were again not working, and there were problems with the supply chain. We were picking that up in late 21. People's income going down, people didn't work because they couldn't get supplies, or demand was down, or customers couldn't get there, or workers couldn't turn up to work. So we were picking that up in late 21. His support began to soften, I think. And then I think probably after January, support for the SLPP and president began to slowly weaken. And I think that was as economic effect. So I think, 2021 to early 22, you see this softening of his support. And then things really went, I think probably February, March, it just fell off a cliff. His support basically collapsed. And I think the one critical event which really had a huge impact in our tracking, we also tracked whether people had power cuts and how long. And it was when the power cuts hit, I think it was March, that's when his support really collapsed. I think the one event that really affected people's lives, brought it home, was the power cuts. And so then things went downhill, as you know, till all the chaos in the middle of 22. And then the SJB MPP picked up support. The SLFP may have picked up support initially. We're not sure, that's just random noise, but it appears in our data. Maybe people leaving the SLPP and stopped at the SLFP as a way station. Maybe that's the best place to stop, right? Yeah. And then moved on. And I think MPP and SJB benefited. And so what we saw after the current president was elected in the middle of that year is that support improved for SJB, MPP, went up a bit for Anwar Dissanayake and Sajid. And then later on, we saw some increasing support for Ranil Wickremesinghe and the UNP. So that began to pick up a little bit. And I think from mid-22 to mid-23, what we saw was pretty stable situation, actually. I mean, the thing with SJB support, it's been flat.
Yes. Yes.
I mean, this is a remarkable thing. The SJB support has been flat. And what we saw, then there was this kind of fluctuation between Ranil Wickremesinghe UNP and Anura Dissanayake NPP, which, for those of us who might think in political terms, or maybe that's a very kind of strange ideological thing, but I don't think people are ideological in that sense. But we saw that swing, and that basically fairly stable, but I would say from mid-22 to mid-23. And then early 23 was the IMF agreement. We saw an initial improvement in economic optimism. We tracked consumer confidence also in the survey, and we saw a big improvement there. And I think the situation has improved. Food insecurity is still terrible, but it began to alleviate a bit. Also from the middle of last year, after current president became president. So there was some improvement, I think, in objective conditions, an improvement in people's feelings initially. But then what we see from, I would say, late or mid-23, the IMF agreement was, I think, March. After that initial boost, we see consumer confidence going into decline again, and people continue to face hardship. And then what we see, the UNP initial boost has dissipated. Ranil's boost has dissipated. Maybe why he's still not decided whether he's going to stand again. I can observe this in the press. And what you've now seen in the past year is, from the collapse of the previous government to mid-23, in that chaotic period, SJB, NPP sort of level pegging. What we've seen in the last year is NPP has taken a fairly, statistically, very significantly. It's a real lead of about 10 points, 15 points, and they've maintained that. And I think that's really the story. So the initial softening of support, this chaos, the government collapsed, then this level pegging of these two parties and this kind of initial boost for the UNP. And then in the last year, what we've seen is that BPB is basically consolidating support. And it's now taking support from some of those old SJP voters.
So given that according to your polling, the NPP has consolidated the lead and even grown its lead, there's been some allegations on Twitter that the IHP and yourself are some kind of surrogates for the JVP. I just want to give you the opportunity to respond to those allegations.
So I'll say two things to that. First of all, we're not a surrogate. We have no official communication interaction with the JVP NPP. I mean, obviously, I work in the medical field. I can tell you a lot of doctors increasingly support the NPP, and people I know as well. But we don't have any interactions with them, and they definitely do not fund us, and certainly no political party has given us funding for our polling. Although I would add, we're happy to receive funding from any source to continue our research. We're researchers, so we love having money for research. Yes. So if people want to give us money, any of the political parties, we're happy to take it. The only thing we would do is that, as researchers, we wouldn't allow any sponsors to directly influence the actual questions or how we interpret it. So I think that's all I would say. I have no problem with that. I would say maybe, unfortunately, nobody has given us any money from the political party. Maybe they should, because I think most of them don't do proper polling, don't do any polling, actually, that's from what I understand.
The other question, Dr. Ravi, is do any other countries use this specific approach that's being used by the Institute of Health Policy that you know? I think what people have to point out is that maybe this poll isn't according to set standards, or maybe that's that kind of conversation they want to have. Should I clarify that? Yeah,
so I think this is I think I mentioned before when we first met them, this is a technical issue that maybe needs some explanation. So, and maybe that's what you're alluding to, but maybe people listening may not fully understand what's going on here. So this is not a standard poll. When we say that in January we estimate that so-and-so X has 30% support and somebody else has 25% support, this is not a standard poll where we did interviews in, say, January and then look at those percentages and calculated some confidence interval and say, oh, that's the result. Okay. That's a standard opinion poll. It's 99% of what the polling industry worldwide does. That's not what we're doing, okay, for a number of reasons, I think, very good reasons, and I think pragmatism. So what we're doing, these are estimates on the polling intent, the voting intent questions, are outputs from a statistical model. And the method we're using is something that's called MRP, Mr. P in some quarters. Full name is multi-level regression and post-stratification. So a bit of, tech speak there. And I wouldn't expect anyone to understand what that means. But it's called, so I'll repeat that. It's multi-level regression and post-stratification. There are 3 parts to it. And we use that method. It's a statistical modeling technique. Now, you said which country. It's not a question of which countries, but some pollsters, but primarily right now, the best known is YouGov, which is, I think, a British company, but it works in the US as well and in other countries. YouGov is in the polling industry, has been the main or the first commercial poller to use this method. This method is new, right? I mean, it is very new. And so let me give you some background to this. It's new for a number of reasons. One is that the underlying methods in this, the statistical methods, are also new. So, and then the application to voting is even newer. So I mean, just go back a bit here. I was a doctoral student at Harvard University. I did a lot of statistical courses and did courses on survey design. One of the things I did, how to design surveys, how to do surveys. I actually had that training. But at that time, Harvard has lots of courses on statistical methods. Before I joined, there was no course which taught this thing called multi-level modeling. It was only when I became, was in the middle of my doctoral degree, that somebody started teaching a course at Harvard, which is very unusual. Most things you find 4 or 5 courses you can pick and choose. And in fact, I used multi-level modeling in my thesis. And the rest of my committee, the economists, the number crunchers, they didn't really understand what I was doing. I had to get that professor onto my doctoral committee so he could also understand what I was doing and explain to the others, and then there wouldn't be a problem there. It was so new. So people who could do quantitative analysis didn't even then understand it. So it dates from the late 90s, the actual multi-level modeling technique. It was first used for looking at public opinion polling data, I think in the 2000s. And it was done by academics using historical data. And there's a very interesting paper that came out. I mean, I think it's the first time it was used for predicting an election. It was an academic exercise, some guy at Princeton or Yale. He did analysis using a very odd data set. It was from Xbox users. I don't use Xbox. Some of you guys may use Xbox. Apparently you can do polls on it. He had the Xbox data set for the Trump Hillary Clinton election. Huge data set. And the problem that he had was apparently Xbox users are not very typical of people. They were like 95% male. For some reason women don't play Xbox, right? Or don't answer those questions, and very young, right? So not a representative of the US electorate. But he used this method to deal with that problem, and I'll explain later what this method is. And he got a result which was better than most opinion polls.
This is for 2016.
For the 2016 election. So this is an academic exercise. What happened the following year, 2017, I think, YouGov, which is a commercial polling firm, then used this method MRP in looking at the British general election that year. I think it might have been Theresa May's election victory. I get lost in a lot of changes those days. Yes. And YouGov did this as an experiment. They did their traditional polling and published that every day or every week. And then they did this as a separate exercise and published that and said, look, no, this is our MRP estimate. It's different to our standard poll, but we're giving it to you. And it turned out that the YouGov MRP poll or prediction was far more accurate than their regular poll and than most opinion polls in the UK. They were the only ones really fully to get the election result. And then the other reason that YouGov had done this, which is gets to why we might want to do this, other than the fact it might be more accurate. YouGov wanted, so typical opinion polls in the UK, 2,000 people. 5,000 would be a huge poll, right? But the election in the UK is actually 650 separate elections at the constituency level, right? So the national vote share doesn't necessarily tell you who will win each constituency. And so YouGov's problem was, and there's a problem that pollsters always had, how do we predict results in each of the 650 constituencies when we cannot possibly afford to do a poll of 1,000 people in every constituency, because that would be 500,000 people, that no one has that kind of money, resources, and then they use this method to do this. So this method allowed them to predict at individual constituency level with a much smaller sample. They were using a model. They were using a model from real questions and using this approach. So that's what they did. So they could predict the actual turnout of that election result in terms of seats, and so it became very popular. There was a lot of publicity at the time that they got it right, and I think the fact that the Conservatives were going to win with such a significant majority at the time. And then they've used it in the US, they've used it in the recent Australian elections, they're doing it now in Spain. They're the main commercial proponent, but this method is, as I said, has strong academic roots, and academic researchers have been using this for about 15 years now. But it's quite new. So I would say typically, if you read polls in the US or UK, this is probably 1 or 2% of your polling data consumption.
Right. One of the questions is, we kind of covered this, so I just want you to just what is the sample size and how was it chosen? So there's two sides. So the sample size you touched on,
and so I need to explain the method there, yes.
Yeah.
So let's deal with the sample selection. So as I mentioned, one of the assets we have, one of the reasons we do this, because we can, is we happen to have had this study in 2019, literally before the presidential election. It took 12 months, where we went to, I think, 300 Gramenilla diary divisions across the country in every district of the country, and recruited a nationally representative sample of households, all of whom agreed to be followed up. It's about 7,000.
7,000.
And so we had that. So that sample is very representative. Now, the problem here with a phone survey, which is what we're doing now, poorer people are less likely to have a phone or to have their phone switched on, or they change their numbers frequently. So when we polled that group, and it is the people who eventually answer, not everyone. So we can reach about 75% of those people from 2019, but the ones who don't respond or don't get into the survey tend to be poorer. So that's the first thing you should know. The other thing is that because it's now 3-4 years later, we don't have any 18-year-olds, 19-year-olds, 20-year-olds in that sample. So that's the issue. So what we then did for this exercise, and since 21, we have a second sample, which we get by randomly dialing mobile phone numbers and ask people whether they interview with us by phone, and they do, yes. And then we also ask them whether they will re-interview. 90% of those people say yes. We can call them up again in a few months. And so we have these two samples. I would say 2/3 typically is that original sample, 1/3 is that random sample by phone. The random sample has some advantages. I mean, some strengths, some weaknesses. The strength is it does have those 18, 19-year-olds. We pick those people up. It's weak, and it has a lot of younger people. Younger people are more likely to pick up the phone. The disadvantage of the random sample, it doesn't have many poor people. So it tends to be more male, more urban, more Western province, better educated people, right? Not surprising. So it's a very biased sample. And then we have our other sample, which has its own issues because it can't reach everyone with a phone. We combine it, and then we use the method, this MRP method, and some other things we do to combine that to iron out those weaknesses. So we deal with the unrepresented. There's a bit of unrepresentativeness there. We deal with it using this method. So I think that's where we get our samples from. So I would say it's very representative. The first one is very representative, and the second one is the random phone sample, but we compensate for what we know it's biased. So I think that's the sample selection. in terms of sample size, so this question. So a lot of people ask that. There's a lot of, as I said, there's a lot of misunderstanding, thinking that, because and maybe we miscommunicated, I have to say, maybe it's our fault, that we do mention that, in January we interviewed 500 people, so people think we use the 500 responses for that. That's not the case. Right. So when we publish the January estimates, we're actually using all the interview data from August 21 to February 24. Right, because when we do the estimates for January, we already have some February interviews, right? So we have more than 2 years. We had 16,000 interviews. We used all those interviews to get the January estimate. So that's the quick step. So the sample size is technically 16,000. Now you may be wondering, but how is that relevant to January? Right. Okay, so I'll give you the intuitive explanation. Maybe I'll tell you technically how we do it. Let's say in January, we do 500 interviews. It's quite common that in, say, that sample, there will be nobody from Kilinochie. Or, we might have people from, Kandy, but we don't have any older female respondents from Kandy. By chance, whoever picks up the phone, right? In that 500, you're not going to get representation of all the groups. Okay. Now, let's say we didn't, let's go with the Kilinochie example. We didn't have any Kilinochie males then, right, in January. But we have those other interviews from the previous 2 years. We have interviews from December. And we have a few interviews from February. And maybe there were some Kilinochie male Sri Lankans who answered in the month before and the month after. And let's say, probably would be the case, 70% of them said they vote ITAC. Right? Once we know that, we can say, well, yes, if we had people from Kilinochie who were male in January, probably 70% of them, that would be our best estimate, were ITAC voters. Right? So we use the information from the other time periods or from other districts to get that. Now, let's say we had Kilinochie, we did have males in January, but we didn't have Tamil voters in Kilinochie who voted for Sajid Premadasa in the last presidential election. These ones who responded, the males, they said they voted for, MPP. So how are we going to fill that? Well, that we can also fill because we have voters from Vavuniya, we have voters from Mannar, right?
So and demographic.
Right. So we can use the information from the Mannar voters in January to also get at what would the Kilinochie Sajid Premadasa voters be doing today. So we use all this information using this statistical model to get at what we think each individual it's not each, what we think the electorate would do. And we're not using those 500 responses for January. We actually estimate this for a data file which we've built, which is representative of the Sri Lankan electorate. So it actually has right now about 15,000. No, it's actually about 25,000. I would say artificial people, but they represent the diversity of the electorate. Right. Yeah, and I can go into the methods, but I think this is basically, I'm kind of giving an intuitive explanation.
Okay.
Yes.
There's a question about whether there's any chance your data can be hacked or, misrepresented. Have you had any evidence of your polling? Even the graphics, have you seen anyone tamper with the graphics and put out like a fake? If you haven't seen it, you haven't seen it, it's fine. I don't think it's happened.
I haven't seen it. I haven't seen it. I mean, we careful to put our logo on it with the footnotes in case people copy the image, so we do that deliberately. We definitely see lots of misinterpretation or people spinning it. We tend to avoid commenting on that because, we feel our duty here is just to put the numbers out and it's up to society to interpret.
Right. I also want to just touch on the health policy. So I guess we'll leave the polling behind for a little while. There was a question regarding, because you're from the Institute for Health Policy, there's a bit of conversation around COVID lockdowns, vaccine mandates, that kind of thing, testing.
Yeah.
I think you were very clear the last time you were on here about the need for testing. And I think you were very clear about your idea of lockdowns.
Yeah.
But I think it's important because the question's been asked, not related to the polling, but it's been asked. So what is and I think this is a good time retrospectively to ask you about Sri Lanka's COVID response. You said you looked at it as well, and it's something that you do.
Yeah.
Could you tell us, in terms of the international standards, how Sri Lanka has fared overall, and where you think we went wrong, where we should have done better? I think the testing part is something you've been very clear about.
So it's probably a good time to ask because we just published in one of the BMJ journals, British Medical Journal journals. We haven't publicized it, so we have to put out a press statement and put out some stuff. The findings from a very big study we did with Johns Hopkins University to look at Sri Lanka's COVID response. It was sort of retrospective. Yeah. And we used some of this phone survey data as well. Right. So this is one of the few research items, academic items, which use this data. So what was now I'll tell you what we concluded, the kind of overall big findings there. So first of all, what we conclude in terms of the initial the initial response was good, partly by accident, and then the subsequent response was a failure. In fact, as I said even at the time, probably the worst public health failure in this country for half a century. Right. So let me start off with the first year. 2020 was unusual, and we show this in the paper. It was unusual because, and I'll give you a kind of little data snippet here. Sri Lanka was one of the probably 20 countries in the world where life expectancy increased in 2020. Yeah, people think, the pandemic health is getting worse and people have lockdowns, they can't go to the hospitals. Most of the world, life expectancy dropped. It was a huge impact. We've never seen anything like this since Spanish influenza, right, for 100 years. But there were a few countries, 20-odd countries, where it actually went up. We were one of them. So government's own official data on mortality, not COVID mortality, overall mortality, shows a drop in mortality. And why were we in that bunch of 20 countries? Those 20 countries were the zero COVID countries, so called those days, right? These countries like Australia, New Zealand, Vietnam, Cambodia, Bhutan, so Taiwan, not a country technically. And then, Japan and Korea also did.
These are countries with extreme lockdowns.
No.
These are the opposite. These are the ones that said open up completely.
They had, pretty much everyone had lockdowns at some point. But the secret in that first year of these zero COVID countries was they basically did all the same three things. And we initially did the same three things. They secured the borders. We did that effectively. And we say in the study, and I have to say, I would commend maybe it's sometimes unpopular in some areas of civil society. I mean, we benefited from the contribution of the military, who handled the quarantine system, and we should be grateful for that. We were able to minimize, not completely stop, but minimize entry of the virus for about 12 months. So that was great. That's what all these other countries did. Seal the borders. The second thing they did was they said, look, we're going to still get infections and we're not completely stopping people landing, right? We can't stop. So like it's not North Korea where they can completely seal the border. We still have planes and ships landing. They go to quarantine. Even with a good quarantine system, infections are still going to get in. So when that happens and we find cases, we have to do contact tracing and isolation immediately of close contacts to prevent it going further. That we did really well. So we cite some data. This reflects the strength of our public health system. A typical contact in 2020, a typical case when they did contact tracing, we would find 20 close contacts, 25 close contacts, and they were all put into isolation. UK, they could only find 4 or 5. The UK was terrible, right? But we did really well, like Australia, like New Zealand. So we got that bit right. The third bit was where we got it wrong, and it eventually caused the strategy to fail. And that's what I have to say. It's a feeling of saying I told you so, but unfortunately it's correct. What we got wrong, what these other countries did better than us, was they understood you had to have symptomatic testing of coughs and colds at primary care level in the community. Not random testing, which is what we often did. Not testing of better off people if they could afford private testing, which is what we did sometimes. Not, oh, we'll test everyone in some community because we're going to put them on a lockdown, which is also what we did. And not testing of people in hospital when they're so sick that they have to be admitted, which is what we often did. Testing of coughs and colds and fevers. We never did that. And I may have mentioned this before, but the research behind that approach comes from a Sri Lankan Australian researcher. We did not know. And we did interviews as part of this study of senior politicians, civil servants, people in the medical community, people in the military. And what we heard was two things. We heard from the political level, if the Ministry of Health had told us this, we would have given them the resources. And we know they had the resources. World Bank gave us money, which was in the end not spent. We had money for testing. We even turned down testing machines. There's a big scandal, right? In the middle of 2020, the Ministry of Health turned down testing machines, right? And then when the Randix outbreak happened, they didn't have the capacity. And the military also told us. We heard from the military, people blame the military for handling this. The public health decisions were based on what the Ministry of Health, public health people said, and they did not tell or understand themselves the critical importance of testing like this. And so the thing failed. And what that modeling by that Sri Lankan Australian did back in early 2020, it basically said, if you don't test enough, you'll get hidden chains of transmission. They will last for weeks and months, and then when they appear, they're too big to control. And so they said, her strategy, that researcher, the colleague's strategy was, in Australia, we need to have sufficient testing so we catch these outbreaks. They're going to happen, but we want to catch them when there's still about 20, 30 people in the community, because at that size, we can probably have a good chance of squashing it. The Brandix outbreak, we now know. We know from two different sources. So one is from the CJR researchers. They did the genetic analysis of the outbreak from the Brandix virus. Clearly indicates the virus probably came in around June. If you do standard epidemiological analysis, it also points to an entry around June. So from June to September, we had a hidden transmission chain infecting hundreds of Sri Lankans, not being picked up because we weren't doing this community test. So that's why the strategy failed. So the strategy failed after 1 year. Then controls were lifted, and then want to let tourists in. They never really were able to raise testing enough. I think the Ministry of Health senior officials gave up trying to control it. It was more like a mitigation, this kind of thing. And then we had Alpha and then Delta. And what you see in 2021 and 22, and this is now official government of Sri Lanka data, right? We're not making this up. Huge spike in mortality. So I'm not looking at COVID deaths. COVID deaths are only 14,000. If you look at the overall deaths in Sri Lanka from 2020 to 22, that's those 3 years, there is an excess 40,000 deaths. And this is despite the fact the death rate went down in 2020. Those other zero COVID countries managed to keep the death rate low all the way through to the end of, say, 21. Eventually, they all gave up trying to control, and they all eventually opened their borders. But at that point, they were vaccinating people, and they could prevent deaths. What happened in our case was the virus came in before that in a big way. And so I think that the death toll of the pandemic for Sri Lanka is probably not the 14 or whatever thousand the Ministry of Health reports official data. It's certainly based on the government's own official data. We're talking about almost 40,000. And we had a huge increase in mortality, and we would have had a huge drop in life expectancy. So then our mortality pattern went from being like Australia's to being like the UK and the United States. And what we now see in very recent data, actually I have not seen discussed in the media, maybe I should write something about it, in the most recent estimates of mortality from the statistics department, or they've given estimates up to mid-23. And we have continuing excess mortality, higher mortality than we should expect, continuing into 23. That I don't think is just COVID. I think it's economic crisis. But in 23, the population shrank. This is the official government statistics. I've not seen any comment about this. Sri Lanka's population shrank, and according to the statistics, and the reason for that, one of the reasons is that this increased mortality. So these are serious things. So I think what our kind of take on the responses, we did initially without realizing why, public health failure to understand the role of testing, then the control strategy collapsed. But on other positive sides, quarantine worked pretty well, border security worked pretty well, the vaccination program worked really well. But there is one weakness, there were two weaknesses. We didn't really go for vaccinating kids. We should be vaccinating kids right down to 5 years or 3 years. And we the messaging was terrible in general, and so we never got high uptake of the booster. So in fact, right now, what I would tell everyone who's listening, I would say as a public health physician, COVID is going to be with us for pretty much for a long time now until we figure out a solution. You should probably get a booster every year, every 6 months. I happen to travel frequently, so I've had 4-5 boosters,
Okay.
right? And so I do that on a regular basis. But that's what it's not a possibility for Sri Lanka.
Right.
Government isn't buying those vaccines. But if you had, that's what you should ask your politicians to provide that. But yeah, I think the vaccination was okay, but it has some limits. The other thing was testing. Vaccination was monopolized by the state. A lot of, which I think was correct. Testing was opened up to the private sector, but what happened with testing, it became very unequal. So our analysis shows vaccination, no income inequalities, no real ethnic inequalities. There was some delay with the Muslim community, but that was it. But it's pretty much equal. Everyone got vaccinated. For testing, a very big rich-poor difference in access to testing. And that was because we chose to go with this, okay, let's bring the private sector in. And, testing at that point, it's a preventive public health strategy. That's like the kind of thing you should put into, depend on private.
You mentioned the excess mortality.
Yeah.
Did Sri Lanka have higher excess mortality than some other countries that you noted at the time, at least in that period?
So what we show, there's a chart in our paper. We compare ourselves to the zero COVID countries. So in 2020, our mortality fell dramatically. That was a real offense. That's why I know life expectancy went up, and all those other countries went down as well. And we had a similar reduction in deaths in 2020 to Vietnam, Australia, New Zealand, etc., Cambodia, Bhutan. But then you see in 21, those countries sort of maintained it. Ours shot up again. And it went above the typical level to above the typical average level. We had extra deaths. And we went up to the levels of the US and UK. So that was 21, 22. Those countries, eventually, the death rate started to go up as they let COVID, the virus in, but they were vaccinated. But they never had this huge increase in mortality. We went from Australia and New Zealand outcomes to US, UK outcomes. I think the previous president of the US and the UK were the models, so maybe that's what he wanted. Because I noticed that in the vaccination study, that was the model. So we got what we wanted, or we got what the president wanted. Wasn't so good for 40,000 Sri Lankans.
You just mentioned about boosters vaccinating children. Yep. There was a report recently, I think you discussed this, but I just want to touch on it because we have a bit of time.
Yep.
Regarding the new study on COVID vaccines.
Yep.
And these links to very rare conditions. And it sort of created a consternation amongst the population about the safety of these vaccines, whether this was something we should have done. And you've just said that you should get your kids vaccinated. And I know that I'm expecting, my wife's expecting, so it'll be a father soon. So it's an interesting question that when I was getting the vaccine, I didn't think twice about it. I'll take it again. If health policy dictates that. If it's a child, there's always a little bit of extra question. Is this safe for my child?
Sure.
Should I take it? And also we've been told that younger people, generally have better immunity. They can generally take the COVID infection better. Is it really important? And then you have the conversation about herd immunity as well, whether that's something that children can get herd immunity instead of getting the vaccine. So I want to just unpack a few of those things there. I mean, I know it's
Sure.
a lot, but if you could just go on giving us a rough idea on your point of view and the data that you used to back
on
that
the
up.
study and the general issues around it.
Yeah.
So let me just remind you, back in 21, we, as in the rest of the world, as WHO, the regulatory authorities, the public health authorities, approved COVID vaccines on an emergency basis for giving out, and countries, governments, in most cases, pushed everyone to get them, at least all adults. Now, this was not based on the normal assessment of safety. All vaccines have, like any medicines, like all medicines, even paracetamol. If you take enough paracetamol, you're taught this in medical school, you can die. Not that many, actually. You die of liver failure. I won't say what that number is here on this. We don't have a good thing to say. We all know that. So all medicines, all vaccines have potential side effects. Vaccines are no different. Vaccines generally are safe, but when they were authorized on an emergency basis in 2021, it was done because millions of people were dying, and the judgment, which I think was correct, was even though we didn't fully understand the risks, it was clear that whatever those risks were, they weren't at such a high level that it overrode the fundamental, I would say, public population need to get people vaccinated to slow down the virus and also to protect people. So I think that's the emergency case, and that was correct. It remains correct today. Now, this study is about very rare side effects. Okay, now, I was asked about this by another journalist, and I said, this is really much ado about nothing. When I read I think somewhere in the Daily Mirror, actually, it's not your newspaper, right, or you up for. I saw this report about these comments from the medical community, and I didn't pay much attention. I thought it was, it's kind of strange, but I'm not going to waste my time. And then I was asked by one of your colleagues to about this. I investigated. I think this is more a reflection almost of illiteracy by many of our medical professionals. Probably one of the reasons we did badly in 2021 in the COVID response. Right. So let me explain what that study was about. So I think it's a study in the journal Vaccine. It has good people did it. It's a WHO-supported research network. The significance of that study was that this is the largest study done with good quality data to estimate or look for side effects. And they were looking particularly for cardiovascular and neurological side effects and muscular. Young people might get that. And they did it in, I think, 10 million people. 10 million people from 8 countries around the world had access to very good data. And they were able to quantify, they looked for problems, and then if they found a problem, they quantified to say, what percent of people getting the vaccine would get this problem. They got very accurate estimates. So that's the significance of the study, right? I mean, it's a good study and welcome. But is it a news story outside the scientific community? It shouldn't be. Basically, what their findings on the size or the frequency of the side effects were consistent with what we already knew. In fact, some of the side effects were listed in the WHO emergency authorization. They even picked it up in the initial clinical trial. So things like this were known. What they did was they just put better numbers. There was only one small side effect, I think, which was newish. It had been suggested, but nobody had quite really kind of fingered it properly. And that one, with their huge 10 million sample, they found, I think it was like 10 cases. 1 in a million, right? They said, this illness that they detected, I think they said, only 2 people should have got it because it happens for other reasons. And they picked up 10. And so, yes, this is statistically significant, but 10 out of 10 million. And that was the only new finding. Now think about it. We're saying 2 versus 10, so 8 extra people, 7 extra people got it, and we vaccinated 20 million people in Sri Lanka, well, 14 people will get it. This is not something to, this is not, sky is not falling down. I have no idea what some of my medical colleagues were thinking. Probably they didn't read the paper, or maybe they don't understand numbers properly. And so it's nothing to get excited. It's a non-story. The real story here, as I said, it's how the medical community reacted to it. That's more of an interesting story for me.
And in terms of children, have there been any enhanced risks to children of getting the COVID vaccines, or maybe is there a difference between the mRNA versus the regular type of vaccine? Do you see any?
So the mRNA vaccines, in the end, were the safer vaccines compared to AstraZeneca.
Okay.
So, in fact,
Safer in what sense?
So AstraZeneca had a lot of side effects, and in fact, many countries like Australia withdrew AstraZeneca. Okay. Right. I mean, and there's an issue of risk balance. So people knew what the risks were. It's not that they're saying these are completely safe. We know they're risks, but in the overall scheme of things, it's still safer if everyone takes it, because fewer people are going to die or whatever. And so the risk balance is different for young and old. Older people have worse side effects of COVID, more likely to die. And so the benefit for them, the cost balance is usually more positive, right? But for young people, less likely to die or have serious side effects from COVID. And so there, the risk balance is different. So in case of AstraZeneca with Australia, they started picking up these clots, and people had after having the AstraZeneca very quickly, because they have something called an immunization register, which is something we need in Sri Lanka, but we don't have. And so they started withdrawing it for younger age groups, and then it went up the age groups, and eventually basically it was not available. I think it's no longer available in Australia. So there's a different risk balance. So I think the mRNAs tend to be much safer. And that's what this study actually showed. The mRNA, yes, they have certain specific side effects, muscle problems, for example, various kinds of blood cell problems. I won't go into detail, but which are very specific to those vaccines. But they are generally very safe. And in fact, the pharmaceutical industry is now working on using this mRNA technology for other vaccines. So it's not just COVID, not just emergency vaccines. So I think they're safe. I think for kids, yes. I mean, you have to think. I said, if I was the health minister in the cabinet, I would raise taxes to pay for this. But of course, as you know that. But I would buy these vaccines, and I would also be buying influenza vaccines, which is actually, because it's now in the influenza category. Even if these infections like COVID or influenza don't kill you, particularly for working people, you can be sick for 3 or 4 days. I did speak, and I can tell you that I had some interaction with some politician. I'm not going to name that person. Fairly well-known person had influenza, and as a politician, probably meets hundreds of people every day. So you're like very exposed. And I asked the wife, maybe he should get the influenza vaccine, which is not available. It's not done here. But in rich countries, they give influenza vaccine on an annual basis, and it's often free. And I think we should be doing that, and we should be adding COVID boosters, because the COVID vaccines from 2020 are no longer useful. The vaccine has evolved, and so you need essentially to update your immunity every year with the new strains. That's the wrong word, but the new variants. And so you need, just like with influenza. Influenza also changes every year. We give people ideally a vaccine every year.
So Dr. Ravi, just one more question, and it will be, I think you have to take off the Institute of Health Policy hat and speak to us on economies, because I know you've got some views on the economy. And the last time we spoke, we talked about the political class really not understanding the problem of revenue in Sri Lanka. We've just had decades of, inadequate revenue. But when you look at the current trajectory with the IMF, I think we've missed pretty much all our revenue
as
targets,
predicted.
I think as predicted, which is also the case for most IMF programs, let's be fair.
And it's the case for all revenue forecasts by the government of Sri Lanka. This is not a. It's a feature of the system. It's not a bug. It's the feature of the budgeting process. Yes,
it's the rule, not the exception. So, how do you view, just very briefly, how do you view this current trajectory? Because I think the idea is that we will reach debt sustainability in a couple of years' time, regain access into capital markets and re-borrow ISBs, and then get back to I guess, where we were in 2021, maybe?
19 or 18.
With any luck. But I just want to give you the opportunity just to give us a very general sort of overview of what you think the listener or the audience should know about the trajectory we're on right now.
So I think that we're not going to be back to normality. I will tell you that. So, I mean, the bad news that people need to understand, even if we met the targets in the current IMF agreement, we will not be back to normality. So this program is not designed to put us in a normal position where we have a sound foundation for solid, rapid growth. Nonsense. We will be extremely vulnerable. So, and I'll explain that a bit further, but in terms of what's happened the past year, I think, there have been slippages, right, as you would expect, but the economy has been stabilized. We have access to foreign exchange. These foreign exchange is now coming in. It's not so restrictive. And growth, I think we started, or at least there was some growth in the past few months. So we have made some progress, and we shouldn't. I wouldn't diss that. I mean, it's in the positive direction, even if we're not hitting all the targets. But I think that at the end of the day, this is an interim agreement. It's designed, yes, to get us back into the capital markets, but it is not designed to give us much flexibility. So if we stick with the current IMF agreement, we will be in a straitjacket. We will be under the control of these institutions. We will have very little flexibility to do what voters want. Governments will find it very difficult because, if voters want certain things and the government doesn't have money to spend on those things, because they don't have enough taxes, that's going to be a political problem, right? And, I think it's Dr. Shamini correct. I noticed she wrote an article a few days ago, and she's correct. I mean, even under the IMF targets are reached, two things to know. We will still be a highly indebted country. The debt will stabilize at 120% of GDP. Wow. It will stabilize, right? This is not a normal country. It means we will be extremely vulnerable to a sudden global economic shock. If global interest rates suddenly go up, if the global economy goes into a big recession, we will be stuck. We will go over the cliff again. This is just to get us, it's like an emergency program to get us back on our feet, but we're not in a position to run, right? And secondly, I said there's no money in the system. Why? Because even under the agreement, the taxes are going to go up, but I think half the taxes are going to go in interest payments. And this is even after we repudiated some of the debt to our domestic creditors through the DDO, but also we don't know about the foreign debt yet. Right. But so it is not a good position, and it's not a good political position for any future governments. I think the real question is, I think we made some progress. But the real question is, if we want solid growth, if you, as Sri Lankans, want your country to be a rich country one day, you want your children and grandchildren to live in a rich country, which is what I want, right? I want my children and grandchildren to live in a developed, high-income country. I want my country to be as well off as Vietnam or as Thailand or Malaysia. They're going to be rich countries. Right? In 30 years, if you have an interview with me, Vietnam will be on the verge of becoming a developed country. They were poorer than us before COVID, right? If we want to be in that position, we're not going to do it with a debt over at 120%. So the bottom line here is, it's the same old problem. The tax target is too low. And there have been some American observers who also pointed out the IMF tax targets are too low. Really, we need to raise taxes, I think, to around 20% of GDP. The IMF target is 15.
Are they around 12 right now?
No, the target eventually is 15.
But
I think we're about 12. 12 is no higher than it was under the previous, before 2019, right? Previous time the Ranil Singh he was Prime Minister then. So this is not a great change, and we have this huge extra debt to pay off. So I think we really need 20%. That would allow us to pay back debt fast, and it would allow us to invest in public infrastructure, invest in health, in education, which is what the voters want.
Yes.
And social chances to make things like a bit better for the people at the very bottom who have to suffer through this transition.
Dr. Ravi Rannan-Eliya, thank you very much for being on Insight with us, and look forward to speaking to you again.
Sure.
Thanks a lot.
Thank you.